Hello, my name is Dr. Dylan Remick with HealthSource Chiropractic in Baxter, Minnesota, and we have Ruth, who is nice enough to be here today to share her chiropractic story. So Ruth, tell us a little bit about how you were feeling before you came into the office.
Before I came into the office, I was in pain 24/7. I wasn't able to function normally. I actually left my home to move into an apartment because I couldn't take care of my home properly. I couldn't mow the lawn, I couldn't walk my dog. Dizzy. I was extremely dizzy. Had been to several doctors, had even been in the hospital. Medication wasn't working. So I had a lot of things going on, and I was extremely depressed and had pretty much given up on life, a normal life.
Were you working at the time?
I had quit my job in January. I felt that the pain was affecting my ability to deal with my clients in a proper manner.
Mm-hmm. Okay.
So I had given that up and sat home and cried a lot.
And when you went to the emergency room, what did they give you as options to be helped?
They really didn't give me any options. I was told it was vertigo. They kept me in the hospital overnight and did some physical therapy, gave me medication. Just prior to meeting you, I had been on a camping trip with my grandchildren, and when I got back, I had the dizzy spells again.
Wow.
Extreme. I called my daughter. She took me into urgent care, and the doctor said, "Oh, it's a sinus infection, which is causing the vertigo to come back. Just take the medication that they previously gave you." And that was about a week before I was lucky enough to meet you, and you had asked that maybe I wanted to come in and do a consultation, have some x-rays, and I am 90% pain-free.
Great. Now, how did you feel after you moved into the apartment, after you quit your job? Did you start to get better?
I did not. In fact, after getting into the apartment, it got worse. I was to the point where we're on a second floor, and I was having trouble getting up the stairs. And then it was, oh my goodness, what do I do now? So, like I said, it was a pretty depressing, because I have a lot of energy. I love to camp with my grandchildren. We love to go on adventures, and Grandma was no longer physically and mentally able to do those things.
Yeah. So what did we do or say, because we mentioned Crosby, what did we do or say that made you want to come here or start treatment?
Well, just in the few minutes that we were together, I mean, you found in my neck that there was a problem. You mentioned my shoulder, there was a problem. I thought, you know what, I've been to chiropractors in the past. They didn't even do x-rays. They just kind of pushed and shoved, and you tell them that it hurt, and they just kind of ignored it, and they just, out the door you went. They didn't say, well, maybe you should come back, you know, things like that. I mean, I even remember now, years ago, going to the doctor, and he gave me a shot of cortisone and said, well, this might help, but if it doesn't, you know.
Come back.
Yeah. So this has truly been a blessing.
How do you feel now? We've been working together for now just almost a month now.
Yeah, I feel wonderful. This is my kind of weather. So this afternoon, being that I haven't been able to walk any distance, I'm going to take my first walk just to see how things go, how far I can go. I don't want to push it too much the first time, but I'm really excited about getting outside and walking.
How are the stairs now getting up to the apartment?
I don't have to hang on to the rail anymore.
Perfect. What would you say to somebody that was like you, that didn't know if chiropractic could help, and they were nervous or didn't know? What would you tell them?
I've told them that you have been a lifesaver for me. This has been a wonderful experience, and I would say to anyone that has pain that they're not sure about, and with me, the doctors are giving you pills and saying, here, this should help, but you're taking them, but you're truly not seeing a difference. Take that step, take that first step and see a chiropractor.
See if something can be done.
Yeah.
Perfect. So listen to Ruth if any of you guys have problems that you think could use help, don't hesitate to give us a call, and if you live somewhere else, we'll find somebody for you. Phone number is 218-454-9355. Thanks.